Hello and welcome to the Australian Commission on Safety and Quality in Healthcare's webinar on clinical and technical governance in digital mental health services. We start the session today by acknowledging the traditional owners and custodians of the land on which we meet. I'm coming to you from the lands of the Gadigal people of the Eora Nation. I pay my respects to elders past and present and extend a warm welcome to Aboriginal and Torres Strait Islander peoples joining the discussion today. We also acknowledge people with lived experience of mental ill health and recovery, and the experience of people who are carers, families, and supporters. This webinar focuses on the importance of both clinical and technical governance. These concepts underpin many of the elements in the digital mental health standards, and we know that there is a strong link between good governance practices and delivering safe and high-quality health services. And so the Commission is very pleased to facilitate today's discussion with our panel of expert speakers. Please join me in welcoming our guests, Dr. Victor Storm, Senior Clinical Advisor for Digital Mental Health at the Commission. Good morning, Victor.
Good morning, everyone. Thank you, Chris.
We're also joined by Margaret Banks, Director of the National Standards Program at the Commission.
Thanks, Chris. Good to be here.
Dr. Mike Millard joins us also, Clinical Director at the Clinical Research Unit for Anxiety and Depression at St Vincent's Hospital and Director of This Way Up.
It's good to be here.
Later, we'll be joined by Dr. Jonathan King, Founder and Chief Growth Officer at Lysn, and finally, a very warm welcome to Sandra Rigby, Project Officer in the Digital Mental Health team at the Commission. Good morning, Sandra.
Thanks, Chris. Great to be here.
We encourage our participants joining us today to make use of the discussion function. We're interested to hear your thoughts and comments on all things governance, and happy to take questions via the Q&A function as we move through each of the speakers' presentations. And you'll also have the opportunity to pose questions directly to our panel of expert speakers during the live Q&A session shortly. Let's begin by moving to Senior Clinical Advisor for Digital Mental Health, Dr. Victor Storm, for some comments to open today's discussion. Thank you, Victor.
Thank you, Chris, and welcome to all our participants. Well, sound and effective governance lies at the heart of any successful organisation. Without good governance, procedures and processes, it is almost impossible to conduct a successful enterprise. Safety and quality depend on robust internal processes within an organisation that are flexible, nimble and responsive for the management of an effective service. It is why one of the 3 standards for digital mental health is devoted to this key service function. Sometimes, as an individual, it's easy to feel overwhelmed by the apparent myriad tasks required. However, if you get together as a team and break up the tasks, sharing portfolios within your leadership team, you can systematically work through the processes. There are 4 key clinical and technical governance criteria to keep in mind as reflected within the standards. I'll briefly outline what each cover in turn. The first criterion is governance, leadership and culture. Service providers set up and use clinical and technical governance systems to improve safety and quality. There are further sub-themes below this overarching criterion. These include focusing on the responsibility of the governing body to ensure a culture of safety and quality improvement, organisational leadership, including the development of an effective clinical and technical governance framework, and clinical and technical leadership. The second criterion, safety and quality systems, these are integrated within governance processes to enable service providers to actively manage and improve safety and quality of care. The sub-themes below this criterion include legislation, regulations, policies and procedures. The service provider has to ensure it has policies in place to meet its obligations. Measurement and quality improvement, including improvement of service user experience and outcomes. Risk management, this was addressed in our last webinar. Incident management systems and open disclosure. Feedback and complaints management, ensuring that this is used to improve the safety and quality of systems. Diversity and high-risk groups, ensuring diversity of service users and their support people and high-risk groups are appropriately considered, and healthcare records, ensuring comprehensive, accurate and accessible healthcare records are maintained and are available. The third criterion is on workforce qualifications and skills, and this is about ensuring the workforce has the right qualifications and skills and supervision to ensure the delivery of safe and high-quality digital mental health care to service users. The sub-themes under this criterion include safety and quality training, ensuring that the workforce is appropriately trained, performance management, having a qualified workforce, ensuring clinicians, peer workers and technicians are appropriately skilled and experienced, and safety and quality roles and responsibilities, ensuring every member of the workforce understands and enacts their roles and responsibilities for the safety and quality of digital mental health services. The fourth criterion is about the safe environment for the delivery of care. The environment promotes safe and high quality care for service users and their support services. The sub-themes under this criterion include a safe environment, including identifying and managing risks for harm from abuse and exploitation, privacy, which we covered in the last webinar, transparency in the collection, storage and use of data, costs and advertising, ensuring that the service user is fully informed of the direct costs associated with using a digital mental health service, safety and stability of the information management system, also covered in the last webinar, and continuity and updates, ensuring disruption to digital mental health services from any cause is minimised through effective planning and communication. I'm very much looking forward to each of our speakers exploring aspects of these themes in today's webinar, and we have a stellar panel for you. Our first speaker is Margaret Banks, who is the Director of National Standards, Australian Commission on Safety and Quality in Healthcare. What she does not know about the principles of clinical governance is yet to be written. She will focus on clinical governance from a number of perspectives and address why governance matters, developing a governance framework. The following two speakers, who lead digital mental health services and were both involved in a pilot to test the standards, will discuss governance in action. First, Dr. Mike Millard from This Way Up, based in Sydney, will focus on clinical governance, covering governance challenges, governance enablers, impact of good governance on the service, and what it means to be a small organisation within a larger organisation. He'll be followed by Dr. Jonathan King from Lysn, focusing on technical governance, and he will cover data sovereignty, data localisation, legal obligations, and challenges for smaller organisations. Finally, Sandra Rigby from the Digital Mental Health Services Project team at the Commission. She'll run through the available resources from the Commission to support clinical and technical governance, including action guides and governance frameworks. And then we'll have 20 minutes for your questions. Remember to post your questions on the Q&A space. Any questions that remain unaddressed will be answered by the team after the webinar. Thank you, Chris.
Thanks very much, Victor. And your comments really do highlight how prominent those concepts of clinical and technical governance are across the full breadth of the standards. We now welcome Margaret Banks, the Director of National Standards Program, to talk about the principles of good governance. Thank you, Margaret, and welcome.
Thank you, Chris. So good governance is the foundation for providing safe and high quality services. This extends to digital health service delivery, where there are not only clinical risks to consider, but emerging technical risks for service users delivering mental health care services. Today, I will outline some of the evidence for good governance practices, talk about why governance matters and what happens when governance fails. Talk also about the roles and responsibilities of governing bodies. So what does happen when clinical governance fails? First, consumers are harmed. Their families are affected, their carers are affected. As a group of consumers, they lose trust in the service that's being provided. But there's also secondary victims. The managers, face consequences. Organisations face reputational damage. There's a collective loss of trust within and outside the organisation. So what is clinical governance? It's the concept which ensures everyone is accountable to service users, consumers, their support people, and the community. It's the framework for safeguarding the delivery of care that's effective, safe and high quality. This accountability extends across all groups involved in the delivery of healthcare, including those delivering digital mental health services, its managers and members of the governing body, such as boards and executives. The National Model Clinical Governance Framework was developed by the Commission. It's there to improve people's understanding of clinical governance and provides a practical description of how to put it in place. It's based on the National Safety and Quality Health Service standards, and the framework provides everyone working in health services, including clinicians, managers and members of the governing body, with a clear and agreed understanding of what is part of their clinical governance framework. This enables organisations to implement the systems and processes needed for effective, safe care for people. Clinical and technical governance are in the digital mental health standards draws extensively from the national standards. There are added technical elements that really reflect the environment in which digital health services are provided. The first standard of the digital mental health standards is called the Clinical and Technical Governance Standard, and it aims to ensure that service providers have systems in place to maintain and improve the reliability, the safety and the quality of care that's provided. It includes protecting the privacy of users and being transparent about how their data is used. It also ensures that the technology used is both secure and stable. So what's technical governance? It's a recently coined concept for health services actually delivering care in a digital environment. It's best described as the system by which current and future use of information and communication technology is directed and controlled. It's also an integrated part of a service provider's corporate governance, so it's not separate. Technical governance ensures that the technology systems underpinning the delivery of clinical care are safe, assure privacy and confidentiality, and are able to provide stable and secure services in keeping with service users' needs. This includes making sure services are usable and accessible to a wide range of service users and their support people. So safe and quality failures are common. We found when we've done reviews that there are common factors, and there are 7 of them, which are broadly identified as inadequate or no monitoring of appropriate services using safety and quality indicators by the governing board. There's not a focus, the focus is on the financial performance rather than the safety and quality performance by governing bodies. There's a lack of transparency and inadequate public reporting of the failures, both by the governing body and in requirements of the regulator to disclose routine safety information. There's a failure of clinical leadership and management to consistently apply the clinical governance standard, the systems and processes that sit around that. An organisational culture is unfavourable to learning from mistakes and open disclosure. The system's culture and the way that it operates is unfavourable to prioritise patient safety and quality, and the failure to place consumers at the centre of care. So the governing body, its roles and responsibilities are clear. A key starting point for any service is a full understanding of the roles and responsibilities of its governing body. The clinical and technical governance of a digital mental health service need to be conceptualised as a system within a system, a clinical and technical governance system operating within a corporate governance system. It's important to recognise that clinical and technical governance is of equivalent importance as financial, risk or other business governance processes. Decisions about aspects of corporate governance can directly affect the safety and quality of care, and the clinical care decisions can directly affect other aspects of corporate governance, such as the finance and the risk. Governing bodies are ultimately responsible for good corporate governance, including technical and clinical governance. Governing bodies cannot govern clinical services well without a deep engagement of the clinical leaders and clinicians working in an organisation. Clinicians, managers, members of governing body are individual and collectively responsible for ensuring the safety and quality of the care that's being delivered. Clinical and technical governance standard in the digital mental health standards ensures providers have a responsibility to the community for continuous improvement of the quality of their services and ensuring that they are person-centred, safe and effective. As Victor outlined earlier, there are 4 key elements. One relates to leadership and the culture of an organisation. The second relates to the systems that organisation establishes and uses to monitor and measure. The third relates to the workforce, the people that are in the organisation with the right qualifications and skills to undertake the role, and the environment in which care is provided so that the technology and the service is provided in a way that's safe for people. I hope that this overview supports the services think more strategically about their governance, and the Commission has developed a range of different resources to support services in areas of clinical governance, technology, and we encourage you to review our website for the detail on these. Thanks very much, Chris.
Thank you very much, Margaret. A quick reminder to keep your questions and comments coming in the Q&A and the discussion chat, and we'll continue to answer them as we go. It's now my pleasure to introduce Dr. Mike Millard to talk about his experiences as a digital mental health provider and how This Way Up has navigated some of the complexities of establishing strong governance practices. Thank you and welcome, Dr. Millard.
Thanks, Chris. This Way Up is part of the Clinical Research Unit for Anxiety and Depression based at St Vincent's Public Hospital and the University of New South Wales. It's a relatively unique combination of clinical research and technical expertise. Our mission is to reduce the burden of mental illness by providing accessible evidence-based treatment for anxiety disorders, depression, and related mental health conditions. This Way Up does this by providing internet-based cognitive behavioural therapy, with our digital mental health programs directly addressing access and equity issues such as long wait times and the affordability and availability of more traditional modes of care. So why do we need good clinical governance for digital mental health programs? In the world of digital treatments, your team might be small, but your patient load may be huge and your impact may be huge. In fact, right now as I speak, we have over 17,000 Australians completing our programs, and we have provided treatment to over 170,000 people across our nation. Another important note when working in this space is that we may be working with a population that is very vulnerable, and the old tech idea of just doing something and seeing if it breaks is not acceptable. For the community, trust and safety in our healthcare are hugely important factors. Another important factor in digital mental health is that your users may access your service from anywhere and at any time. On this map, you can see that our users are spread right across the country. And the table on the right is from the Productivity Commission report, and it shows that almost 50% of our users are accessing our treatment outside of our normal business hours. This means it's so important for us to know that we have systems in place to ensure that our high quality care is maintained and that we can appropriately manage any potential risks that may arise for our service users. So no matter the scope or the scale of what you are doing, good governance will help you to deliver a safe service and a better service for all of your service users. This Way Up is embedded within the St Vincent's Public Hospital Mental Health Service. As a result, we are supported by the public hospital's existing clinical governance structure to manage safety and quality and escalate issues when needed through our standing safety and quality committees. Now, it might sound like we've got it easy, but it doesn't end there. Our needs at This Way Up are actually quite different to our bricks and mortar parent. But it does mean that we understand how important governance is in the provision of safe mental health care. However, as a digital government-funded national service, there's so much more that we need to do at our service level to support our clinical and technical governance needs. Now, whether in a large hospital or a small startup, it's all about assessing and managing your clinical and technical risk to protect your service users. These should all be relative to your organisation's size and scope. As a digital service, you need to think about the type of service you are providing, your staff, and all of the interactions that you have with service users. These can be direct and indirect. As part of our pilot accreditation, a really valuable process for us was the development of our model of care. Now, this document outlined our safety and quality roles and responsibilities at a service level, and these included our governance hierarchy for transparent decision-making and clear accountability, our clinical and technical risk management and the systems that we developed to support this, our operational management and delivery, our information security management, and perhaps most importantly, our mechanism for feedback and complaints management. It sounds daunting, but it's incredibly important. And it can all happen in a small team. You don't necessarily need a big governance structure. You just need to know your own organisation. Undertake a self-assessment to look at your service. Who are your service users? What type of clinical service do you provide? What information do you collect? And where and how do you store this? Carefully brainstorm the potential and actual clinical or technical risks of your service delivery model. And who has responsibility? And this goes for clinician-supported, self-guided, or anonymous services. The answer might be different, but you still need to ask the questions. If you haven't already, the Risk Register is a key document to identify risks and outline your mitigation strategies. I like to think of these as a written fire drill, so when it hits the fan, you know exactly what to do. Another important component is to start an incident register to record when things go wrong or they nearly go wrong, which they will. It's important to include on this what you did in the response and the actions that were implemented to minimise the risk of this happening again. I can't overemphasise how important it is to document all of these things so they don't just live in one person's head. This supports continuity for staff, the executive, and is a great way to help orientate new starters. Now, none of these things need to be fancy. Registers can just be an Excel spreadsheet, and the team monitors this and updates it as needed. Risk assessments can be done in-house and don't need to be done by expensive consultants. And I think here today you're going to hear about some of the Commission's amazing free resources, which is a really great place to start. Now, lastly, governance is not just about risk and safety. It's also about supporting quality and the continuous improvement of our services. Now, to support the provision of our safe and high quality care here at This Way Up, we regularly conduct research to build our evidence base, which we then go on to publish in peer-reviewed journals. A good regular clinical audit is actually just as good. It is important also to regularly check that what we say is happening actually is. One of the wonderful things about working in digital is the ease with which you're able to connect with your consumers. We collect as much user feedback as we can through surveys, focus groups, and regular communications, and we use this precious information to continually improve the experience of our service. Finally, as a team, we have a regular operational meeting where we review our risk and incident registers, we look at trends in the data, and then we pull out information that's come through our consumer feedback to inform quality improvement projects and to develop as a service. So don't underestimate the importance of clinical governance, which can very quickly turn your startup into a shutdown. Good clinical governance doesn't need to be complex, so get started today.
Thanks very much, Dr. Millard. As we've heard already today, there are a number of technical risks associated with digital mental health service delivery, which really speak to conducting healthcare in either a virtual or an online environment. So we're now really pleased to hear from Dr. Jonathan King, the founder and Chief Growth Officer at Lysn, for some insights on addressing technical governance when delivering a digital mental health service. Welcome, Dr. King, and great to have you with us.
Thank you, Chris. In this presentation, I'm going to look at the technical governance for digital mental health service providers. I'm Dr. Jonathan King and the founder and Chief Growth Officer at Lysn. Before I start, I would like to say I am not a lawyer, and while this is a high-level discussion on technical governance, please seek professional advice with these such matters in your organization. To start off, what is technical governance? Technical governance is the process of managing and controlling IT capability decisions to improve IT management and ensure compliance and increase the value from your IT technology investments. Why is this important? Well, 5 reasons why this is important is to 1, ensure regulatory compliance. 2, potentially give yourself a competitive advantage in your industry. 3, support business goals for optimization. 4, encourage growth and innovation in your organization. And lastly, 5, reduce the risk for your organization. So you probably are thinking, well, how do I embark on this technical governance transformation? And in our organization, well, this can be difficult regardless of the size of an organization. Its challenges arise when companies undertake digital transformation when they aren't ready for innovation. Planning is important and needs to be completed before embarking on this. 3 areas to consider when designing a technical governance framework is to 1, look at your business model and consider it, your operating model and consider its considerations, and customer experience considerations. The challenges for us as an organization or as a service provider is that it can increase costs. It can also take time to develop and need us to seek legal advice. It can also increase the time to train and implement staff. It can also increase auditing time, which can slow your organization down. And it can also increase costs by requiring regular audits and reviews. These issues can impact any organization. As a healthcare professional, what are 2 concepts that we really must know in technical governance? And the first concept is data sovereignty. The other is data localization, which some call data residency. Data sovereignty is a jurisdictional control or legal authority that may be asserted over data because its physical location is within jurisdictional boundaries. Specific data may be subject to the laws of more than one country because it sits within another country's jurisdiction. For example, you may be using an online VoIP service for your customer service staff, and this may be stored in Singapore or USA and is not in Australia. This means that you must comply not only to the Australian standards, but also comply to local laws. When designing a framework or procuring software for your organization, you have to ask some of these questions. What questions should you be asking as a service provider? 1, clarifying what data will be stored. Number 2, clarifying where this data will be stored and if it's being stored in an Australian-based cloud service provider. If you're a foreign provider, ensure that it complies with applicable Australian laws and regulation. 4, ensure your privacy policy is up to date and your clients know where you store the data. 5, implementing a strong data response plan, identifying your business responsibilities and reporting procedures. 6, ask an IT security provider or a legal advisor for assistance if needed. 7, regularly audit your technical processes. The second concept that's extremely important to know is about data localization. Like I mentioned, also known as data residency laws, require companies to store data locally inside the country of collection. In the Australian example, health records and associated data must be processed, held, taken, and handled or stored inside Australia. Data localization rules affect both sides of the digital health equation. It affects patients and providers. If your business isn't directly affected, I'm sure your customers may be. the application that you can think of is that it can cause ripples in both sides of the supply chain, potentially leaving multiple servers in a non-centralized database can create more risk of cybersecurity attacks that, because you are unable to audit and maintain all your servers. From the Privacy Act of 1988, there are 13 Australian privacy principles. They govern standards, rights, and obligations around 1, the collection and use of disclosure of personal information. 2, the organization's agency in governance and accountability. 3, integrity and collection of personal information. 4, the rights of individuals to access personal information. In November 2022, the Privacy Legislation Amendment Bill of 2022 was announced. These targeted reviews on areas such as the extraterritorial operation of the Privacy Act, increased penalties, notifiable data breach schemes, information sharing, and a review of the whole Privacy Act. While this is extremely high level talk about data governance, we are here to look at 5 things as takeaways before I leave you. Is that 1, technical governance is in this global digital health transformation is important. 2, strong planning and execution is needed for a successful technical governance transformation. 3, principles of data sovereignty and data localization. 4, understanding data localization is important to healthcare providers in Australia. And 5, knowing the future of data privacy. These rules are changing and we must keep ahead of it. Thank you.
Thanks very much, Jonathan. Some really interesting perspectives and strategies there on how to manage data governance, and we look forward to going into a few of those concepts in greater detail during the Q&A session. Now, in order to support service providers implementing the standards, the Commission has a suite of resources focusing specifically on clinical and technical governance. We'll now hear from the Commission's Project Officer, Sandra Rigby, to walk through what's been developed and how it can be useful for your service. Thank you, and good morning, Sandra.
Thanks very much, Chris. The Commission has developed a range of resources that can really support service providers establish strong clinical and technical governance. The best starting point to understanding the digital mental health standards and the actions relating to clinical and technical governance is to read our Guide for Service Providers. This provides a plain English explanation of what the governance standard covers and how it should be implemented. You'll find advice on the kinds of evidence you can provide to show how you are implementing each action in the standard. This evidence can range from policy documents to staff training guidelines and risk management frameworks and registers. The guide also includes reflective questions to help you consider how effectively you are currently implementing the actions, and it also features links to further resources. The Commission has also published a number of action guides that are focused on clinical and technical governance, and they've been developed from interviews with service providers. The guides are short, easy to read summaries of key issues and the solutions. The Legislation, Regulations, Policies and Procedures Action Guide focuses on Action 1.07. This guide provides advice on developing a governance framework, risk management, and auditing your existing policies and procedures. The Incident Management Systems and Open Disclosure Action Guide outlines how to set up an incident management system, including undertaking risk analysis and developing an incident management policy. It also describes the principles of open disclosure that should be used when you're communicating an unexpected outcome or harm to service users. There are also action guides on privacy and information security, which we introduced in the previous webinar. The Privacy Action Guide outlines your obligations to protect service users' privacy and how to undertake a privacy impact assessment. The Information Security Action Guide describes some common threats and vulnerabilities, and it also outlines the 6 key steps in developing a risk management framework and the 8 essential strategies you can use to help mitigate cybersecurity incidents. There are also 2 resources developed for the NSQHS standards, which will be useful for digital mental health services as well. Referred to by Margaret earlier, the National Model Clinical Governance Framework describes the key components of a framework, and it outlines the roles and essential partnerships between service users, clinicians, managers, and governing bodies. The principles outlined will apply to most, if not all, actions in the digital mental health standards. The National Standards team has also produced a user guide for governing bodies. This describes the roles and responsibilities of the governing body for corporate governance, and that includes developing strategy, focusing on quality improvement, and reviewing performance. These are key principles that will apply for all digital mental health services. So you can keep up to date with all our publications and news by subscribing to our digital mental health e-newsletter on our website. And you'll find all our resources, including recordings of our previous webinars and a recording of this one, at our resource library webpage. Thank you.
Ready?
Well, welcome back to our panel of guests, and thank you so much for your presentation and your thoughts on the topic of clinical and technical governance. Lots of different perspectives there, and definitely some really helpful and handy hints for our service providers, sort of thinking about clinical and technical governance standards and also those actions which relate to clinical and technical governance. So now we're on to the exciting part. We're going to move to the Q&A session. And we've received a lot of really great questions via the registration portal, so we may take the opportunity to discuss a few of those first, and then address some of those questions and comments that have come through via the live Q&A. So please continue to use the Q&A function and send through any thoughts that you have, and we'll try our best to get through. So Margaret, we might start with you. And a really great question come in during the via the registration portal, and it's around workforce wellbeing, which is obviously a really important topic, considering the position that the healthcare system finds itself in light of the pandemic. So what are some best practice examples of how high quality clinical governance supports the wellbeing of clinicians?
Sure. Chris, the governance standard has a whole stack of actions in it that are there to support the workforce. So giving clear instructions about their roles and responsibilities, providing access to training, making sure that the right people work in the right roles, giving clear expectations around their policies and procedures, looking at how they can take feedback from staff, use that to take action to improve care. All of those are part of making sure that the clinicians and clinical leaders, and in fact the general workforce, are involved in how organisations operate. A healthy workplace culture leads to a more productive, satisfied and motivated workforce. The structures in the governance standard can provide the framework for that to happen.
So it's really important to have everybody across the whole breadth of the organisation understand very clearly what their roles and responsibilities are.
Yeah, it absolutely is.
And we had a comment come through via Max, who's said, how do we shift the dial from governance being considered as this ticking the box exercise to be something that actually provides a safe and effective environment for staff and service users?
Assessment to the standards, as people often think about it in terms of a ticking the box exercise, that's a problem because a set of standards is like a university course. You go, that's where you get the knowledge, the skills, the capabilities. The implementation of the standards are the things that give value both to the organisation and to the clients. Where you have an assessment process, the tick box part, that's a verification. It adds value in that the public can say that systems and processes are in place. If you take it as a tick box exercise, then sure, you don't get the value out of putting in place the things that can give your organisation, a chance to provide care that's safer, higher quality, and engaging for consumers and for the staff.
Great, thank you so much, Margaret. That's a great answer. Jonathan, we might move to you now. We covered a few elements of this next question in your presentation, but we have a participant wanting to know how data sovereignty is incorporated into the overall governance of data within an organisation.
And that's a great question, Chris. And I think what we have to really look at is, data sovereignty and data localization. There are these rules that we have to incorporate across our organization. It can't just be, as we move forward into a digital world, we can't see it as a side part of our business. And we have to see as one, being a service provider, how does, being not data first, but, data aligned, that one, how do we align it with our business values? How do we align it with operational values? How do we align it with, costs? Where service providers are so focused on delivering high quality outcomes, sometimes we don't have the margins like, other companies or tech companies to really put that infrastructure. So how do we do that? And I think, developing, if we're a service provider, how can we develop a simple framework of governance so that we can at least help procure the right tools that are safe for our patients and our customers or consumers in the community. So I think there's different levels. It really depends on which area you sit, whether you are building your own platforms or you're using someone else's platform. But I think if you think of data, being data aligned for the benefit of the patient, that will go a long way.
Wonderful. Thanks so much, Jonathan. Victor, we might move to you now. And we had a question around if the Commission had any guidance when working across the care continuum. We know a lot of services work across that care continuum, which might involve state health systems, primary health networks, and also primary care providers. So I just wondered if you might be able to make a couple of comments in relation to that.
Thank you, Chris. Well, the principles of good practice don't really vary with the setting or the medium. The principles are the same. So it's really the responsibility of all providers, service providers and parties, to ensure that the continuity of care is a core focus of their operation. And the critical parts of this pathway are often the transitions between care providers. And so you really have to ensure that the right information gets to the right person at the right time. I mean, it sounds simple, but it can challenge quite sophisticated organisations. I can see you all nodding your heads. We've all been there, but they're the principles and they don't change.
Yeah, and transitions of care is quite often one of those situations where patients can definitely be at high risk of harm. So the standards really do speak in a number of actions to the importance of transitions of care and what that means in terms of referring patients on to other services from a specific digital mental health service. We were also asked a question around some of the education gaps we're seeing emerge as a result of the digital mental health standard. So sticking with you, Victor, I wondered if you might have any thoughts in relation to some of those education gaps or some of those early lessons that we've learned.
Thank you. Well, I mean, keeping up with data and privacy issues is really a challenge for all organisations. And making sure that your hardware and software are up to date, as well as constantly thinking about your data retention practices, as well as non-required data disposal that is secure and safe. One of the other big areas which we're going to address in our next webinar is making sure you've got meaningful partnerships with your service users. And that means establishing within your governance structures that you've got service users involved and participating, and also having them participate in the development of digital mental health tools and engaging with them to support evaluation of service delivery, which is really essential to making sure that we improve and improve the quality of the way we do this work. And as I said, that's the topic of the next webinar, so that will give us quite a bit of discussion on that. And you also really have to look at the information security management systems and making sure you can map your data flows to ensure you understand what information is being used, moved and stored. And Sandra has already presented the digital mental health action guides and the user guide, and utilising those resources, these can help you support your thinking about these more complex issues. So I think that's probably enough.
Thanks, Victor. And I think the action guides really did stem from the pilot project that we undertook back in 2021, and they were developed around some of the themes that digital mental health service providers found to be a little bit more complex or a little bit more challenging. So as you mentioned, Victor, I think they're a really good place to start. Mike, we might move to you now. And during your presentation, you talked about the importance of user experience and that being really central to supporting a wide range of different service users. So I'm wondering if you can provide us with some examples of how good governance practices can address the needs of equity groups, which we know are definitely frequent digital mental health services.
Sure. So I go back to the idea of process is so important. So the process of implementing the standards is very important. And why I say that is, for us, it's really clarifying who are our users. It's having a close look at who our users are. What do we know about them? What are we doing and how are we doing it? So in working out the answers to those questions whilst keeping a good eye on, we'll call good clinical governance or access and equity, the answers might be very different that you come up with. So is my intervention going to be something that's very bespoke, that directly addresses an area of a priority population? Or is our intervention going to be something that actually takes the pressure off the system to allow our more intensive resources to be used to address the access and equity issues? But the frame stays the same, but the answer to the question might actually be quite different. So I really emphasize that those are the things that come out when you start asking and self-reflecting on how do you fit into that ecosystem that our services are all part of. And of course, the other thing and the wonderful thing about digital is that we can collect data. Now, that's great. Just because we can collect a whole lot of data, as I think we've been talking about, doesn't mean that you should. You need to be very careful about what data that you collect. One of the things that we've been doing is we've been working with ACON around the best way that we can address that priority area. And so we want to work with them around what are the questions that we can be asking so that we're able to work out what our service is doing at the moment and what the gaps are, and then how can we address it. And it really is that whole quality improvement system.
And presumably there's a bit of a link there between setting the right kind of policy at an organisational level to address the needs of those service users.
Sure, that's absolutely correct. And it's very much a culture that comes through, that goes down.
Absolutely. This next one's a question that we do get asked quite frequently at the Commission, and it's how can services meaningfully engage with service users who wish to remain anonymous, which is quite a frequent feature of digital mental health services?
Yeah, it is an interesting question. And I go back again to really being clear about what your service is, what it's doing and why it's doing what it's doing. One of the points that I was thinking about in answer to this question is when we're working in this space, we might think that digital is something new and scary, and this is a question that hasn't been addressed before. But I guess our sexual health clinics have been providing anonymous services for decades now, and they've really had to nail down the managing safety, effective services and privacy for all of the obvious reasons. And I think we can learn so much from that, that we don't have to think that we're new and scary, but we can actually accept that these are questions that have been addressed within our bricks and mortar services that we can learn from and see how they apply to the different contexts. This way up, service users aren't anonymous, but we really collect as minimal amount of personal data as possible, quite deliberately, as you know, we were deliberate about when we worked through the pilot. And the most important thing is if you're collecting information is that it's actionable and that you use it. And then I really think that the idea of trying to collect as much feedback from anonymous users as possible, it's just so valuable. The fact that someone has taken the time to write to you to tell you that you can do something better because they believe that you can is immensely valuable.
Absolutely. And we just had another comment come in around the importance of ensuring that the consumer voice is embedded within the governance, the decision making, the design, and also the evaluation of services. I'm wondering if anyone has any comments in relation to the importance of ensuring that consumer voice is heard in those contexts.
Go ahead.
The evidence is clear, and that's why a national clinical governance framework includes partner with consumers. That you get a much better, much more robust service when you've included the consumers in the design, evaluation, performance management, and governance of a service. Your service is stronger, and it's much more tailored to the needs and preferences of the people using it.
Perfect. Jonathan?
I mean, we see consumers and patients, they want personalized care. And yeah, it's great we have these frameworks and we're pushing for more consumer interaction. But yeah, we as companies, if we think in an agile manner, well, we should be reaching out to customers to let them drive what we're building next, to influence, because they're the ones we're looking after. And if we don't hear what they want, well, we're going to miss the point.
Yeah, absolutely. I'll just come back to you for a moment, Mike. We've got a question come in from Gretel. What are some of the challenges you experience with developing your digital clinical governance structure within that existing support of St Vincent's Health Australia?
I think one of the challenges has been working out where our existing clinical governance structures sit and where they end and what might be different about what we need. I think the standards do a wonderful job in adding in the technical governance and also the emphasis on partnering with consumers, which I hope feeds back into the other standards. And so it's really part of that mapping process. And I have to say that the Commission made it very easy in a sense when we're working through the pilot. Sorry, I do, so I give you the compliment around that there's tools online that help you to be able to do that. And that means it really is just so wonderful that we have the ability to step back and to be able to reflect on the practice and to be able to adjust our practice in a way that really provides safe and effective care in an area which is developing.
Absolutely. And Jonathan, I might just come back to you again for a moment. You touched on the Privacy Act in your presentation, and previously we've presented on a session with the Office of the Australian Information Commissioner. And I just wondered, in the context of tech startups, what governance frameworks or regulatory legislation they might need to be mindful of when they're embarking on this process of setting up a digital mental health service.
That's a great question, Chris. And as we've seen, as digital health has grown in the last 5 years significantly, these rules, this industry is outgrowing the current rules, and that's why we're reviewing, the government's reviewing the Privacy Act of 1988, and I'm really looking forward to how we make it, fit now. But as there's all these things about AI and ChatGPT and things that we're really going to have to build something that's scalable from I guess a tech startup landscape or a healthcare startup specifically, or a healthcare service provider. Well, you really have to understand, those key points of not just the Privacy Act, but data localization and data sovereignty. So the fact that healthcare records, Australia must keep them in this country. And so when you're building a platform, make sure that, if you're using the cloud service, you're making sure you reach out to their account managers, understanding they can help you with solutions architects to really help you ensure that you're storing it safely using their tools. Over the last few years, we've really seen those cloud providers like AWS, like Microsoft and Google really step it up, and they have so many tools to help you. And so really just ask. But I think, really understanding, if you're a tech company, you need to be looking at if you're storing mental health data or healthcare data, you need to be localizing it. If you're looking at, as a service provider, making sure that you procure platforms that do that. And so asking those questions, I think I have a slide about, asking what data is being stored, where it's being stored, and so forth. So really making sure that we're doing privacy impact assessments on things that we procure. And if we do that early on, it's not only going to be, while it seems time consuming as a start, it's going to be cost savings in the long term.
And it probably also emphasizes the point that data mapping is really important. You need to have a very firm understanding of what information you're collecting, where's it stored, and where it's flowing to and from. And I think that really mitigates a lot of the risk if you have quite a clear idea of how it's all mapped.
Exactly. Being data aligned is important. Maybe not data first, but being data aligned for sure.
We've just had another question come through, and happy to open this up to the panel, but are there any specific governance considerations for AI-enabled digital mental health services? Definitely a bit of a hot topic at the moment. Is there any considerations that service providers might need to think about if they're integrating AI technologies into their digital mental health product?
I would, I'll jump in here. I think this is a space that we all have to keep very aware of, and really see where the Privacy Act sits. I think that, saying an AI or chatbot or something, that's not specific. Are we dealing with clinical data, or are we using it as a customer experience tool, to help with FAQs and, bookings and so forth? By defining that, then you'll know which side to go under. And then, you can go into specifics, and maybe too much for this panel right now, but defining PII and, HPI and so forth. So I guess really defining which side of that narrative are you trying to sit on, and really then defining what is considered healthcare data. And then if you're going to sit on the side of, let's say, I'm building a patient experience AI tool, then how do we remove certain identifiers to make sure it's not a healthcare, it doesn't require data localization, or if it is a healthcare platform, making sure that, as I mentioned, data localization on the server and all storage is being stored in a really safe, secure way locally.
Yeah.
I'll strongly support every word that Jonathan has said.
Anything else to add there on that question? No. Okay, perfect. We've had another question come in from Maria, and it says, what about the integrity of referral systems? So I presume that means a service that a patient may be referred on to after using a particular digital mental health service. Are those organisations you refer your clients onto also accredited to the standards, or should they be accredited to the standards in order to ensure that they're safe and high quality?
When we talk about accreditation in any setting, there should be a process that says the relationship that you have with your contractors or subcontractors should ensure that your values and the goals that you're looking for are met. Now, how you do that, it might be built into the contract, it might be through joint agreement, but there is an expectation that if they're providing part of your service, then they are working towards complying with the standards in the same way. In hospitals, we think about it in terms of the cleaning staff are part of the infection control. The cleaning that they do has to be up to the expectation and meet the requirements. There's no reason why a service provider in the digital mental health space would be any different. You would just need to work through what service do they provide, what's their role and responsibility in safety and quality, and then how do they comply, and how do you know they comply? So what reports or monitoring is in place to allow that to occur?
And I think that's a really important point. You need some level of assurance that they do comply.
That's
and,
right. You've
particularly,
agreed that it should happen, and you monitor to make sure it happens. Yep.
absolutely. All right. Well, we are nearing the end of the Q&A session. So I thought it'd be really great to again divert to our panelists one last time. So in the context of everything that we've discussed today on clinical and technical governance, I'd be grateful for one last key message to share with our participants today. I might start with you, Jonathan.
Yeah, thanks, Chris. I would put a key point here is, try to get your head around data, privacy, localization, residency, and really start to procure software properly in healthcare. So if you're a service provider, ask those critical questions to ensure that you're using a platform that actually is protecting your client's data or patient's data. And the last thing you want is you providing a great service and being caught out because you didn't know how to procure the right software.
Yeah, excellent and sage advice. Margaret Banks.
I think if you think of clinical and technical governance as the foundation to providing safe and high quality care, then you focusing on it and putting the actions in the standards in place will ensure that you have got a robust clinical governance system. It does not have to be complicated or difficult, but it does need to be in place.
Mike.
I think the message I'd give is don't let your introduction to clinical governance be under the blowtorch of when something goes wrong, because something will go wrong. So I think that even attending this webinar today is a wonderful step on that, and it's definitely something to be on the front foot with.
Thank you, Mike. And finally, Victor.
Well, as I said at the start, it may seem daunting, but if you get together as your management team and work collectively as a team on the various areas bit by bit, making use of the Commission's resources or any other resources that you'll find useful, you'll get there. But it's not a job to be tackled by one person. It's a team effort.
Fully agree. And that's unfortunately all we've got time for today, ladies and gentlemen. So I want to extend a really big thank you to all of our guests for sharing your knowledge and expertise. It's been great to have you join the discussion today. If we didn't get to your question, we apologise. Our team will attempt to follow up with you via email, or alternatively, you can send us an email or any additional questions through to dmhs@safetyandquality.gov.au. A reminder that a recording of today's webinar will be made available on the Commission's website shortly. So also we ask you to stay tuned for the details of our fourth webinar, which is coming up in a few weeks' time, This time, we're going to be talking about partnering with service users, and we'll hear from a range of different service users, carers, and family members about their experiences with both using and supporting the use of digital mental health tools. So we hope that you are able to join us again. Thank you and goodbye.